Welcome back. Migraines can cause debilitating pain, but many people think they are just headaches. Here to tell us why that's not the case is Dr. Simon Fishman, who is a neurologist and the director of Integrated Neurology Services. I want to make sure I'm not messing that up.
You got it just right.
Well, okay, let's start off and first off, thank you for being here.
Thank you for having me.
Migraines. Not everyone understands the difference between a migraine and a headache. Can you break down that for us?
Sure. Migraines are a specific type of headaches. We refer to them as vascular headaches, but they're a combination of chemical and electrical impulses in the brain that cause a constellation of symptoms, most oftenly manifested with headaches. But there are other symptoms as well: nausea, vomiting, sensitivity to light, sensitivity to motion, and some people will actually lose vision with them. And so there is a lot of secondary phenomena that really can be almost as debilitating as the pain itself.
And I know it's some 30 million Americans suffer from migraine headaches. Women tend to get them more often than men. Why is that?
The short answer is hormones.
Great.
Right. And so boys and girls before puberty have an equal frequency of migraines, so 1-to-1 relationship. After puberty, it's a 3-to-1 female-to-male relationship. One of the ironic or troubling things is also the time when women are most busy. So if you think about it, a professional woman who's got children, who's trying to keep a job,
sure,
and once or twice a month, she's at least down for the count or trying to fight through being down on the count.
And I know that there was a new study out there that basically surveyed a bunch of people who showed that there is this stigma associated with migraines, that a lot of people dismiss them as not being as severe as some other diseases or issues that people might be fighting through. Can you talk a little bit about that, what those findings were, and drive home the fact that this is important for people to be aware of?
Sure. When we try to compare between various disease states, we talk about the impact on life, quality life indicators. And so when they did this study, they studied 130 people with chronic migraines, 130 people with episodic migraines, and for a control group, they put in people with epilepsy.
Okay.
And so the people who had chronic migraines were almost as debilitated as the people who had epilepsy, and had more equal amount of stigma to it. I think a lot of it has to do is that we look at pain as subjective, and it to a certain extent always is, but we can't see how much pain somebody's in. If
sure,
somebody's throwing up, if somebody's arm is broken, if there are other, we can say, oh yes, they're truly sick. I think we have a tendency to minimize, and I think there is a certain amount of chauvinism in it, because these are women primarily who are missing work or can't show up to activities, and so there's sort of, well, she's not cutting it, she's not being able to be one of us. And so a lot of women will suffer through it and go to the activity or go to work. It's a horrible dilemma to be in, between skipping work and being considered not one of the team members, or coming to work and underperforming and then being labeled, well, she's just not that strong.
Right, right. No, it's a very serious issue. I know a lot of people will say, yeah, I've just got an awful headache. I know for me recently, I would say in the past 1 to 2 years, I've been noticing my headaches getting more severe. Is this something that you can develop later on in life, and what are some of the warning signs?
So everybody's different, and we were talking off stage to somebody else in the crew who gets migraines, and the first question he asked me is, does this run in families? Well, that's true. About 80% of people who have migraines have a family history. And it can come on with different life events. And I see during times of stress, during times of hormonal imbalances, during times of missed sleep, during times of that certain foods, and especially this time of year when there's change in the barometric pressure, often that will trigger migraines more often.
It's like the humidity?
Well, it's humidity, but it's also those storms that come in out of nowhere.
Oh, sure.
And so I tell my patients, you know, when you hear on the radio or on television that a storm is moving in at midnight, you should be hearing a migraine maybe moving in tomorrow morning. And therefore, by knowing by knowing your triggers, you can prevent migraines. Now, for those people in my practice who have more than 2 migraines a month, I talk about a prophylaxis, putting you on a medication that you'll take every day to prevent you from having a headache. But even on the best hands, under the best circumstances, we need to make a plan for when you do get a migraine. So if you know that you have certain triggers, and you know that storms or barometric pressure trigger your migraines, then taking a couple of Advil before you go to bed might be all you need to do. For women during their menstrual week, sometimes we'll give them medications just that week. And then there's also medications to treat when you get the headache.
Oh, really good suggestions there. For the people who might get the occasional migraine or think that maybe it's just kind of on the severe end of a headache, any foods that we should avoid, any other tips to kind of lessen the effects of the migraine/headache?
Well, migraine you asked me about distinguishing migraines from bad headaches. Migraines usually occur on one side of the head as opposed to the whole side of the head, and they have those secondary phenomena of visual disturbances and nausea and dizziness. But there are certain, mostly women again in my practice, who just assume being a woman is having a headache at least once or twice a month.
Happens a lot. I can relate.
And the reality is you don't have to live that way. And most of my patients, once they get headache-free, say, you know, I never really understood how many headaches I was having and what's it like not to be in pain on a regular basis.
And I know I was talking with one of my coworkers who said that she knew someone who had very severe migraines, cut out the gluten, and that killed the migraine.
Absolutely. So about 15 years ago, we were putting all patients on this sort of prison diet, you know, not quite bread and water, but no bread and mostly water. And water is incredibly important in hydration. But most people have not recognized, you know, every time I have Chinese food or every time I have red wine or very aged cheeses or I have bologna that's coming out of a package, I get a migraine. So think about things to avoid is anything that's very processed or very aged. Those are full of tyramines and nitrates, and those have a tendency to create migraines, or at least increase the likelihood of having a migraine.
Great. A lot of great information. Dr. Fishman, thank you so much for your time. We really appreciate it. I know I'm going to start to reevaluate my habits and my diet and hopefully cut back on those headaches. Thank you.
Thanks for having me.
Well, coming up, some moms in Beverly Hills have made an interesting choice for their afternoon pick-me-up. Find out what they're using to help get them through the day. We'll be right back.